Today I'm going to answer the question, how can I manage the pain associated with fibromyalgia? Now, from a traditional medical point of view, as you are no doubt well aware, things like Cymbalta, gabapentin, Lyrica are given for fibromyalgia. Now, most of the patients that I talk to that have taken these medications say they don't really work well, and some people actually get worse with the medication. Now, remember, if we're using medication to treat fibromyalgia, we're actually not treating the fibromyalgia, we're treating the symptoms associated with fibromyalgia. That means we're not addressing the root cause of fibromyalgia. Let me mention here quickly that I'm going to give you a discount code in just a couple of minutes at the end of this video that I think you'll be very happy with. But to help you understand the way that I think about this, I want you to work with me for just a moment. Use your imagination as we consider how to manage this pain. Now, let's say you and I have a mutual friend that was struggling with a very serious health condition, and it actually doesn't matter what you call it. Now, let me give you a brief biography of this woman's history. She lives next door to a paper mill, which sends a steady stream of toxic waste into the air. She's been in an abusive relationship for close to a decade with her current husband. She smokes 2 packs of cigarettes a day and tries to self-medicate using alcohol morning, noon, and night. Her primary food intake is highly processed and sugar-filled. Her chief complaint is she's always tired. She has gastrointestinal distress, generalized pain, brain fog, and has frequent headaches. Now, you and I have been tasked with the job of helping her regain her health. Now, what's the first thing you would tell her to do? Now, keep in mind, the body has an innate, God-given ability to heal itself when given the proper opportunity. You don't have to be a functional medicine practitioner to be able to give our mutual friend some good advice. Now, the advice that I'm thinking about could be called low-hanging fruit in her life. By low-hanging fruit, I mean things that are easily changed to move her towards better health. Now, we know for sure an abusive relationship can take its toll on you both physically and emotionally. We know living next to an air-polluted paper mill can lead to environmental toxicity. We know without question that smoking and drinking can be hazardous to your health. We know a diet heavy in processed foods is bad for you for multiple reasons, and we know that a high sugar consumption diet suppresses your immune system and causes a multitude of underlying issues. So maybe we would tell her, hey, come live with us, get out of that abusive relationship, get away from that toxic paper mill, stay with me, and I'll help you quit smoking and drinking. I'll even cook for you meals that are predominantly whole foods to help restore your health. Now, if we made those changes in the life of this precious woman, do you think that would have an impact on her health? Now, I admit I made up a pretty horrible scenario for the sake of this illustration, but because I want you to see that anything you can do to remove harmful stimulus and add nutrients that are missing and move towards a healthy lifestyle can make a big difference. This would have to bring her closer to being healthy and give her body a chance to do what it does best, which is heal itself. Now, if you're getting anything out of this video, please take a moment, like and subscribe to the channel. But using our fictional friend, it was easy to see things that were hindering her health. In your case, it may be a bit more subtle. Now, if we're turning that same concept towards you, a fibromyalgia sufferer, we know that the same principle of good health will at least take you in the direction that you want to go. The problem with trying to tackle a diagnosis of fibromyalgia is that no one seems to know what the root cause is. Now, what I have found is that there's always multiple layers of dysfunction in a fibromyalgia patient, and they have to be peeled away like the layers of an onion. So we're talking about managing the pain associated with fibromyalgia. So my first choice, rather than managing the pain, is getting rid of it. But let's start with simply removing things that we know are harmful and adding things that we know are helpful. And it's important that you realize fibromyalgia seems to run on a spectrum of severity and complication. What I mean is that there are people that are diagnosed with fibromyalgia that just have a few things going on, like food sensitivities, pathogenic bacteria in their gut, and let's say a yeast overgrowth. These things can be bad enough to lead you to the diagnosis of fibromyalgia because they're toxic and they create inflammation. They can create body-wide pain. Yet on the far end of the spectrum of fibromyalgia, you have people diagnosed with fibro that have also been diagnosed with multiple autoimmune diseases, uh, Hashimoto's, rheumatoid arthritis, Sjogren's, as well as irritable bowel syndrome. And perhaps you've been diagnosed with, or they have been diagnosed with dysautonomia, as well as leaky gut syndrome. They may be highly toxic with environmental toxins or heavy metals. So these people also get labeled with the diagnosis of fibromyalgia, but the underlying and initiating factors are much more complicated. In essence, what I'm saying is that some fibromyalgia cases are just much more complicated than others. But in every case, we have to move towards improving overall health. Some people get the diagnosis of fibromyalgia and become paralyzed, not knowing what to do, so they do nothing. Now, if we're going to move people on either end of the fibromyalgia spectrum towards better health, we have to start with the low-hanging fruit. And I generally discover this low-hanging fruit with a thorough health history, metabolic assessment form, and advanced lab testing. But again, because I don't know you personally, I haven't interviewed you, we have to start with the basics. So we know sugar consumption is absolutely horrible for your overall health. So if you want to control the pain associated with fibromyalgia, it's important to stop eating sugar and things that turn to sugar quickly. It isn't going to be easy or fun. No, most of us are actually addicted to sugar. Now, there are several food groups that also tend to aggravate fibromyalgia, and I've seen this by doing hundreds of food sensitivity tests on numbers of different people, and I see a number of things come up again and again. It's dairy products, wheat, corn, and soy. For some people, eggs are an issue. You can also add coffee and alcohol for some people. Now, I know you might be thinking to yourself, I've tried this before and it didn't work. Well, unfortunately, in order to see the impact of removing these food groups from your diet, it can range from a few days, a few weeks, and for some, 3 months to see the real impact it actually has. And the impact is always progressive improvement until one day you wake up and you realize how much better you actually feel. Now, keep in mind that I'm aware that there are many underlying complicating factors besides your diet, but I'm trying to give you advice that's very general for the express purpose of minimizing your pain. Now, if we want to actually remove these underlying factors, then we need to do a thorough health history, the metabolic assessment forms, the advanced testing to find out what is specifically blocking your health. Then we create a diet and a supplement regime for 30 to 60 days that'll actually address your specific underlying problems. Now, talking about sugar again, I heard a physician talk about research on fibromyalgia that said the underlying factor is blood sugar instability, or a main underlying factor is blood sugar instability. But unfortunately, that research was legitimate, had been squashed. And I wonder, maybe someone doesn't want you to know. But let me be sure you understand what I'm saying. The testing will show me if you have a vitamin deficiency, if you have a detoxification problem, if you have mold toxicity or environmental toxins. It'll show if you have leaky gut syndrome, food sensitivities, maybe a hidden viral infection that's aggravating your immune system, but I'm giving you general advice to minimize the pain. So avoid foods that I mentioned, sugar or things that turn to sugar like pasta, rice, bread, white potatoes. Avoid dairy, corn, soy, wheat, and possibly eggs. Remember, caffeine and alcohol can also be pro-inflammatory. Now, I wouldn't blame you if you're thinking, then what in the world can I eat? Your diet really does need to be centered around whole foods, including healthy lean protein and vegetables, raw or sauteed. You can eat some fruit, but you need to eat fruits that are low on the glycemic index, which are normally pitted fruits or fruits that have pits in them. So now there are 4 supplements that are so important to improving your overall health and minimizing pain that I have to mention them. They're magnesium, vitamin D, omega-3 fatty acids, and B complex. So magnesium helps improve sleep, elevate mood, enhance bone health, muscle recovery. It boosts energy levels, improves digestion, regulates blood pressure, increases mental focus, and lowers your risk of diabetes. It's also a natural muscle relaxer and reduces inflammation. Vitamin D, as in dog, D as in dog, strengthens your immune system, prevents certain type of cancer, boosts your immune system and your mood. It can aid in weight loss. It can lower risk of rheumatoid or arthritis or autoimmune diseases, lower the risk of type 2 diabetes. It can help lower blood pressure, and it might reduce the risk of heart disease. Then omega-3 fatty acids support health. They ease inflammation, improve mental health, enhance brain function, support joint health, benefits depression and anxiety, may improve eye health, may reduce symptoms of ADHD, could reduce symptoms of metabolic syndrome, which is a blood sugar issue, might benefit autoimmune diseases, may help prevent age-related mental decline like Alzheimer's disease, may help prevent fatty liver, and may improve sleep. And then B complex, which is the final one, will help with cell health. So we're talking the cellular level now, growth of red blood cells, energy level, eyesight, brain function, digestion, appetite, and proper nerve function. And for fibromyalgia sufferers, that's very important. Now let me say, before you run out and buy any of these supplements, don't waste your money on drugstore or big box store vitamins. The bulk of those vitamins are synthetic and they're extremely inexpensive to make, so they're more profitable for the producer. You need to know this. There are 3 grades of vitamin and supplements. There's feed grade, which is what we give to animals. Food grade, which is what's sold in the big box stores. And then there's pharmaceutical grade, which is what you get from your physician. Now, pharmaceutical grade means it's been checked by a third party to guarantee its potency and its bioavailability, which means your body can break it down and use it. One of my favorite pharmaceutical companies is Design for Health. You can't buy directly from them unless you go through your physician. And I'll actually give you a link that will allow you to purchase from them if you choose to. And I'll also give you a discount code to save 20% on anything that you buy. But I'll also list in the description the specific magnesium, because there's a few different kinds that I recommend, and the vitamin D and so on. I'll leave a link, as I mentioned, in the description below of these specific recommendations. But in order to truly overcome fibromyalgia and minimize the pain associated with it, you need to do a thorough health history and a consultation with a functional medicine practitioner. Short of that, you need to do everything that you can to move towards overall health. So again, to reiterate, avoid sugar at all costs, avoid corn, wheat, soy, and dairy, add magnesium, vitamin D, omega-3 fatty acids, and a potent vitamin B complex. Now, if you've gotten anything out of this video, please like and subscribe, share it with a friend who might be suffering. If you'd like for me to help you personally, feel free to reach out to me. You can call my clinic directly. You can email me. You can even go to my online schedule and set up a time to talk. The initial consultation is free of charge as well, so really there's nothing stopping you. Anyway, guys, thank you so much for your time and attention. I hope this has been helpful. God bless you, and have a great day.
If you are struggling with a chronic condition and would like more information, feel free to visit www.birminghamfunctionalmedicine.com. You are also welcome to set up a phone or Zoom consultation with Dr. Dailey at www.talktodrd.com.